If you look at this region, it has been very, robust in dealing with this, even though it's a new experience and it's a very young country when you look at healthcare, because the healthcare as such, if you look at it, is only 50 years old here, whereas in other countries, it will be much more older. And it has taken it very well, if you look at UAE or the GCC as a whole. But one thing, as we are looking at what is that has come out and how you are looking forward. So one of the important things that is going to happen here is that digital transformation. So our CTO was telling that according to him, the COVID has been the most potent digital transformation tool rather than the CTO himself. So that he was actually shooting himself on the foot, but telling that, which is true. So we all realize that, like Ms. Das said, no, for many years we were all professing, saying the importance of digital transformation, telehealth and all, but nothing was happening. Suddenly people now get up and you see large number of teleconsultations happening, telemedicine gaining, and that is something which is going to stay. So answering your question, Vivek, one of the important, very important areas will be that digital transformation. So that is one of the important things. Then you also will see that there is a difference in the way in which the business look or the management looks at the requirement for people, at least in the area of non-medical area. That is a back office work, administration work. We have now in the last 2 months, we're working from home. And this has become a new way of life. And we realize that many things can be done from home rather than being done at the office.
Yes.
So this has given the insight that if it can be done from home, why can't it be done from a country where it could be much more economical and done more efficiently? So one of the things which is going to change definitely is going to be the offshoring business, where people will be looking at ways in which this can be done in other countries at 1/5 of the cost that we are incurring here. That will be a transformation, and that is going to be a major change according to me. And the third thing which I want to tell is the digital transformation, especially in the KPO area, the knowledge process outsourcing. Apart from the what is happening from the side of the demand by the customers, in the backside also we can improve our efficiency if we start doing the knowledge process outsourcing. One of the things which we are trying right now is to look at ICU monitoring from a country where the cost is much less when compared to what you spend here. So if you have a large requirement, which we have now, we have largest number of people on ventilators and the ICUs are full and we are trying to add on facility. So in that situation, isn't it possible that a large part of this can be actually monitored from a third country where there is more of availability of skilled manpower, as well as it much more economical? So this is exactly what is happening now. We are now in discussion with the DHA to get an approval for at least managing some of these cases, taking the rounds in the ICU, as well as doing many of the things usually being done by doctors here back home. ICU, telemonitoring of the ICU by the doctors as well as by the nurses, and having minimal staff being deployed physically here.